I am going to get us started. My name is Danie Eagleton, and I'm a licensed mental health counselor, and I'm the director for counseling and psychological services at Seattle University. I'm your facilitator for today's webinar on building healing communities on community approaches to behavioral health. Our call to action series is spearheaded by the UW Medicine Behavioral Health Institute, or BHI, at Harborview. We sincerely thank the Washington State Healthcare Authority for their generous funding, making this initiative possible. During today's webinar, please utilize the Q&A function to type your questions for the presenters. If you encounter any technical difficulties, please notify us in the chat. The recording of today's webinar will be available on the BHI website, past events page within the next week. As we get started today, I want to just give you a little bit of context about this webinar. On February 16th, the BHI held a convening on BIPOC Black mental health as part of the Call to Action series. The convening held 3 panel presentations: community approaches to behavioral health, workforce development, and youth support. During today's webinar, we'll take a deeper dive into community approaches to behavioral health. I'd now like to invite our panel to do a short introduction of themselves. Let's start with Ms. Teri.
Thank you so much, Danie Eagleton, for allowing me to be in this space. I am humbly grateful, and I acknowledge and recognize my privilege to be able to share with you all this morning. I am Teri Kemp. In my real job, I am a criminal defense attorney. I've been practicing for over 20 years, and I have the privilege also of serving folks who are marginalized in community, mostly Black and Brown men, women and children, and otherwise marginalized folks in community, representing them through the criminal justice system, as it is referred to. I also am the chair of the board of Black Lives Matter, Seattle King County. I have been a community advocate and activist for police accountability laws since 2012 in community. And I also am a member of the Coalition School South King Emotional Wellness League, working with other community organizations to better support Black and Brown mental health. And again, I'm super grateful to be here. Thank you so much.
All right, Ms. Tanzania.
Thank you. My name is Tanzania Zenzali. Thank you, Teri, for setting the pace. So my regular day job is I am the program manager for public health equity at the Urban League of Metropolitan Seattle. I have been a public health practitioner for a little under a decade. I'm currently working towards my master's in public health at the University of Essex. And I'm really excited to talk about mental health and the call to action within this community with you all today. So thank you.
And Mark.
Thank you, Danie. Well, it's hard not to smile when you're, in a conversation with such amazing individuals, and I'm including everybody that's watching. I think we all have something in common. That is, we know we can do better, and we're going to do better. My name is Mark Fadool, and I've been working within the community mental health system for a long time, numerous decades, in regards to my work in Washington State, was a therapist and clinical director at the Odessa Brown Children's Clinic on Yesler for a number of years, and had the privilege of working within that community. And that clinic was, once again, was created and developed by the community, by strong women of color. We'll hear more about that as these questions start to unfold. I've had so many learning experiences, whether it's working in residential and detention centers, at the University of Washington. I've been blessed to be around extremely wise and compassionate individuals. And I've also seen things that are absolutely harmful to the communities that we are talking about today and who we've served in the past. And that's mostly marginalized poor communities and communities of brown and black families. I couldn't be more thrilled to be a part of this, because goodness is here right now. It's being done. And there's no way we're going to walk away from this without going, wait a second, maybe we could try this. So anyways, thank you for having me, Danie.
Absolutely. Oh, this is a fantastic panel. I am thrilled for us to, for the panel to share their wisdom, their insight, lived experience about existing community approaches, and to talk a little bit about what works and what's needed. So here we go. Here is our first question. And I think, Tanzania, I'm going to start you. And here is the question. How do you define behavioral health within the context of our community, and what unique factors contribute to mental well-being?
Okay, so I recognize, especially for people who come from a more clinical background, that this can get relatively complicated when you're talking about the individual psychological issues that somebody might have, or the neuroscience of someone's brain. But especially when I'm dealing with the public, working in, as the program manager for public health equity, really trying to make things from a health literacy point of view, and like keeping it simple so that it's consumable and we can kind of build from there. So for me, I would define it as the behavior part as making choices that are going to bring a positive outcome to your life. Right. So that applies to the gal that's experiencing anxiety, and that applies to the person that might be suffering from substance use disorder. And then the mental well-being part, I recognize that it's so important for people to be connecting with their doctors and getting the referrals they need, and even having healthcare to be able to do that. But I do think it's really important, specifically within our community, to have a self-driven attitude towards your mental health. Because it's in your body, you're the one experiencing it. And I feel like it's really, really important to try to utilize the tools or the resources or the access that you do have to create a plan. A personal wellness plan, or some people call it like the tool belt, right? Like different tools, you get new tools, you sharpen old ones, so that you can really, you have to begin being an advocate for yourself, I guess is what I'm trying to say. So that's how I view the behavior part as well as the mental well-being.
Excellent. Mark?
Yeah, it's an interesting question, because some people will say mental health, some people will say behavioral health. I personally, and maybe I've been in the field for way too long, but it's about wellness. It really is about wellness. And I think that too often our medical construct, Western medical construct, has really damaged a lot of folks from marginalized communities, whether it's been misdiagnosing them, whether it's using a diagnosis that is not going to get them the services they want, et cetera. So I think we have to, first of all, look at it. Why can't we look through the lens of wellness and joy and strength and abundance? And it doesn't mean that folks don't need skills or guidance, but there has to be a more collaborative approach to healing. And there's healers in the community that have been there left and right that I never interviewed, because they didn't have the chance to go through all the many years of school and how much money and getting credentialed, et cetera. And I'm not saying that's bad. Please don't hear that. I'm saying that we need to really redesign the system, because the current system, once again, I think can do and has done a lot of damage to marginalized folks. And then we have to look at, if you look at wellness, you have to look at the social determinants of health. We don't need to go into all those different ones, but it gets to be, and especially with a siloed system like we work within, it gets to be really frustrating, because it's like whack-a-mole. Once you hit one issue, all of a sudden 3 other issues pop up. And so how do we do this in a more collective, collaborative way, and really come from a foundation of strength and do it upstream? Why are we waiting until families have multiple issues regarding trauma and adversity, and then go, oh well, they don't want to come in, we have a 1 o'clock appointment, and they're not showing up? Well, maybe it's not about the family, maybe it's about a very inflexible mental health system. So the good news is there's plenty of opportunity to make changes.
Thank you, Teri.
Yeah, thank you. The folks that I get to serve on a regular and daily basis are dealing with some really heavy issues. I practice primarily criminal law, working for marginalized people, and getting into the system means that you have a severe lack of basic human needs, social human needs, housing, enough money to buy food, enough money to buy clothes, being in the same school as a 5-year-old or 10-year-old with other children and families who don't have the resources, which those types of situations cause a severe amount of stress and tension, where it's not quite so easy to breathe until finally your behavior expresses itself in oftentimes the manner that you are feeling, which leads you into the criminal justice system. And I then hope for peace in the folks that I get to work for and with, and in defining that mental health piece. It is just being able to have a sense and a feeling of well-being, and the space to take a breath and exhale, and not have to be stressed and worried about the very next huge outcome. And in the end, ultimately having the space to have a positive outlook and hope is how I would define mental health. Yeah. A long definition, but if you have peace and space to breathe, and you have hope, then generally, I think that you are in a stable space to have a positive outlook, which is healthy mental health.
Danie, do you mind if I add something?
I would love it.
Is that all right? This is a conversation. Teri and Tanzania, thank you. So a number of years ago, when we were thinking about building another clinic at the Odessa Brown Children's Clinic, I had the pleasure of working with Dr. Danielson. And if you don't know Ben Danielson, please check him out on YouTube. He's very humble, but he's one of the most eloquent, brightest individuals I've ever worked with. And we started to do demographic mapping in regards to where could this other clinic be, because access, if you don't have access, you can't have wellness. And folks are getting pushed all over, King County, Pierce, Snohomish, due to gentrification. And so we did all this demographic mapping, and just to summarize it, it's no coincidence that the maps in regards to highest rates of diabetes, cardiac issues, obesity, dropout rate, food deserts, teen pregnancy. You can go right down the list. They were all the same maps. I mean, it was like, and so for me, being a visual learner, it was so powerful, disturbing, and powerful that it was no coincidence whatsoever. And so when we're having this conversation today, think about that bigger context. And my goodness, it left us with a lot of questions. And I think one of the major lessons is, how do you sit with that discomfort, whatever that discomfort is for you and your community, and sit and breathe, like Miss Teri said, right? In the public health part, Miss Tanzania, and listen and be humble and start to have those very difficult conversations. But if you don't, and we're not good at sitting with discomfort, but it's not comfortable. It's just not comfortable, and it's not going to be until we start and continue to make these radical changes.
I think what I really am struck by in terms of the different things that you all have said is this idea of being able to get to better choice, to be able to get to wellness. And you can't get to any of that unless you do have some piece to be able to see what's available. But, the idea too around social determinants isn't always about the community that you're born into. The conversation really has to be about, how do you change that to change social determinants? And so I think, again, this conversation is a needed conversation, because that's the work I think that needs to be done. All right, let's go on to our next question. This is so awesome. I can't even stand it. Anyway, what are some common misconceptions or stigmas surrounding behavioral health within our community, and how have you worked to address them? This time, I think I'd like to start with Mark.
Oh, Danie, I was hoping you weren't going to say me right off the bat.
But
I want to hear what these other brilliant
I know you
people have
did.
to say. The first thing that came to mind when I read this question the other day was, you know what? Maybe stigma isn't a bad thing. Now, to hear me out just for a hot second, because I'm telling you, this Western model doesn't often fit the needs of marginalized communities. So, I mean, when you have a history of being misdiagnosed, like working in detention, there's so many. So it was so disproportionate in regards to the young individuals of color, mostly young men, but not totally, that were in there, and they were dealing with adversity and trauma, just as the white kids. But the white kids were diagnosed with anxiety and depression, while the kids of color were oftentimes, not always, oftentimes diagnosed as conduct disorder. Like, does that make any sense whatsoever? Come on. And what is conduct disorder? How does that become a DSM classification? So I think out of protection and out of a history of being abused and neglected by a traditional system, that the stigma might be merited. Now, the catch is communities need support, and so how do we do that in a way that is going to be? I'm going back to like co-design models, collaborative design models. I go back to the Odessa Brown Children's Clinic, where that community met for a year and a half or so and had fiery meetings in the Central District of Seattle, and trying to figure out what were the priorities of the community. It wasn't clean, it was messy, and it was much more productive, because they boiled down to, our kids are our precious gifts, and we have to do whatever it takes. And how do we provide the services, primary care, then dental, then mental health services, to really help our children? And how do you do that under one roof, make it so it's easy, it's attainable? The clinic was right in the middle of the Central District at the time. So I think one, stigma is good, but I think we have to do a much better job doing the preparation with community to figure out next steps.
Love it. Teri.
Thank you. Thank you. I have to say at the outset that My mother, Thelma Mae Williamson Rogers, was the first nurse at Odessa Brown Children's Clinic with Dr. Blanche Lavizo, and the motto "Quality Care with Dignity" came from Dr. Blanche, and John Cannon, the administrator, and the Model Cities program that these amazing Black folks created in the Odessa Brown Children's Clinic. So when you say it, you raise the bar for all of us, and you give me a happy memory of my mama. So thank you for your work, and I'm glad that it still exists. You know, Dr. Danie, as I call you, a common misconception that is a dangerous misconception is that it is not okay to ask for help. You know, the folks that I work with who are also defense attorneys, often referred to as public defenders or public pretenders, or otherwise marginalized by other folks because we're representing quote unquote criminals, working under the stress of the often depressing conditions in helping serve our marginalized community, and not being able to say anything, because if you are in need of mental health support, you are weak, or it even could affect your license. Good folks, I'm sure you all recognize that as licensed clinical healthcare workers. It affects our parenting. Judges being able to make decisions based on the number of times that we have gone to therapy or gotten help. It can happen. It prevents us from reaching out, and it stigmatizes it and makes it a bad thing. And not only is that not true, it is a lie to say that it is not okay to ask for help. And in 2020, when by now 8 years being affected by knowing as a criminal litigator that these police officer involved homicides of especially Black men, knowing that the laws are and were written in such a way that it is dangerously able to commit these acts against our community, and feeling like I'm the only one, because I am one of a very few, thank you to the universe for putting me in the position, who has a criminal law degree, a law degree, and being able to practice criminal law. You're all alone, a voice that is so isolated and solitary. And the way that I helped myself was to address these harmful killings by working with other community to form South King Emotional Wellness League, where we pay for, by generous donations from community like Black Lives Matter, Seattle, King County, licensed Black and Brown therapists to talk for free, anonymously to community. Just sign up at wellbeing@kingcounty.gov. It helps me also in helping my community by providing these resources from professionals like y'all who are here. It lets me know that where my voice was useless, I'm all by myself, I'm alone, I feel helpless, I have made a difference for at least one human outside of standing with them while they are being sentenced in a very stressful situation in the middle of court. That's a lot, I understand, packed into it, but we must get over the idea that it is not okay to say, I'm not okay today. We, each of us, our doctors to one another, because we are not alone in feeling like that, and being able to reach out and have a conversation. Like, bro just talked to me for 15 minutes about gardening or something, and help me to alleviate this stressful 15 minutes that has presented itself in my life. It is critical that we open up that conversation like you have, Dr. Danie, in this whole space nationwide. Incredible work. I'm passionate about this in that sense, that our babies are suffering because they're not able to say, I'm not okay.
Absolutely. Ms. Tanzania.
So I'm gonna answer the question, but I'm going to, I think, shift a little bit. And I think what I'm going to say is something that I have found is very, very difficult for us, even within our community, to talk about, which is, so to answer the question, like the stigma area or the misconception about our community is that the majority of our community is in crime or on drugs or, struggling, coming from this poverty-stricken background. That is not the majority of the Black community. It is not the majority of the Black community that is, like, again, with grace and with like a special truth of heart, recognizing that there are social determinants of health, there are economic aspects that contribute to people getting into situations that sort of almost push or motivate or cause them to commit these crimes. And then again, up against a system that was not really built for them to navigate properly. Like, with respect to that, something that I struggle with when trying to, I'm also on the Board of Health in Thurston County. So I live in Thurston County, I work in King County, and I was raised and grew up in Pierce County. And so to have the experience of all those different counties, as well as gathering information and data, doing these community assessments and sort of canvassing people when we have different outreach and public education events, it's still this idea within our own people that, like, we are the problem and it's all of us. And I have a really difficult time with that. And so I've been trying to create some public education materials and some different kind of interactive games when people kind of stop by our table and things of that nature, to get people recognizing that there is this difficulty within every community. There is a sort of subculture who is suffering within every community, every ethnic background, every culture, every language has, their group of folks that need that extra push or that are struggling in some way when it comes to some dire situations in relation to their mental health or, substance use, behavioral health, and things of that nature. But I really struggle with this, like, politics, like identity politics idea, where it's like, I'm walking in a room and I'm actually there to offer my services in some way, but there's a thought that I am the lesser one. Also, I really, and again, I want to give like this huge respect and this huge grace to people who are advocates and feel strongly that they're acting as allies for our community, and they're trying to shift the narrative as well. And they're standing side by side with us, trying to get those messages out to other people. And I'm so thankful for you. I would also, in the same breath, with love and respect, look you in your eye and say to you, please stop telling me that I'm oppressed because I'm Black.
Come on, bro.
It is outrageous to have someone that is non-Black, not BIPOC. We grew up in the same neighborhood, went to the same schools. I probably have, I don't want to say a better, but maybe a more rich education background. I served in the United States Army active duty for 6 years, right? Like, there's just this constant idea, even by my peers and colleagues, right? Black or white, I'm constantly being fed this narrative, which is a huge stigma. And it's a major misconception within our community that we are oppressed because we're Black. And it is the majority of us that are on welfare. No, it's not. The majority of people in the United States of America that are on welfare are white people in the Midwest and the South. That is a fact. You can look up the numbers, and that is not said with hatred or to be offensive, but it is to be blatant. And it is to begin to start a new standard around conversations when we talk about BIPOC people in regards to what we're struggling with within our communities. It is a small percentage, though the noise is loud and what's happening is horrible. That's what makes it big, right? But when we look at the numbers and we actually assess the data, it is not the majority of our community that is experiencing these things. And I think that's a really important piece to talk about.
You're muted. You're muted.
I know, because I was like, saying all these things. Here's what I have to say. First of all, this panel is amazing. But I would also say, when I think about the issues about stigma and misconception, it's also about who gets to be at the table, who gets to make who gets to have say on the conversation as we create what is needed. And I worry about that a lot. And I think about that based on how someone shows up or who they are, or based on the label of diagnosis. It's one of these pieces where how do we begin to have true conversation about what is needed in behavioral health? All right.
Absolutely. And, you know,
Yes.
boy, I'm learning. I should be writing notes down. Oh boy, I'm almost speechless. I want to say it's relational, right? And so any relationship, and this is what I'm hearing from this conversation, but any relationship has to be based on trust and respect. And when you have a workforce that often does not come from the community, that doesn't have lived experience, it doesn't mean everyone's going to look like you and have the same, but we don't have that. We don't have that in the mental health system whatsoever. And you need time. You need time to heal. You need time to trust, especially a system that has not been, like I said, so trustworthy. And so therefore we have to look at our systems, reimbursement rates, time, you know, like time with a physician or, you know, therapist, because time is weaponized in Western society. And it's weaponized to a point of, you know, dissuading folks from even saying yes, like Ms. Teri said, I need help and I need that support. But it's relational, and it's relational based on trust and respect.
All right, here's an interesting question, because I feel like you'll all have some good things to say. What strategies have you used to engage and mobilize community members to participate in behavioral health advocacy and action? I would like to start with Ms. Teri.
What strategies have I used? So I believe in taking the conversation into practice, and I do not depend so much on I would say that I use all community members in the courtroom is my primary space, but in that space, working with prosecutors and working with judges and working with bailiffs, I somehow or another I raised the conversation about how our behavior and how policies affect community members, which I think I heard earlier, Mark, when you were talking about conversations that are difficult to have. These conversations are difficult to have, and raising the conversation can be uncomfortable for folks. But I make sure to, as a strategy, when I'm in conversation, I like to make it clear that we all are affected, whether we are Black or white or pink or purple, whatever our political or social perspective, we all are oppressed by policies that are not looking out for our mental health, our mental well-being, our permission, our right to be in everyday spaces. And I strategize in the way that being inclusive, that I am just as oppressed, I am just as colonized as the white person across from me. I really, it resonated with me, the conversation, Ms. Tanzania, when you said that it is even our thinking within our own people. So one strategy that I like to use in including all of us in the same oppression, even though it may exhibit differently or experience differently, by including all of us, it tends to work to not only have the conversation, make the conversation more comfortable, as difficult as the words may be, and also getting some kind of a result or change. I remember being in the room and in a particular hearing, and the conversation came up, you know, that we have to follow the laws that were built. And when my response was that, you know, you, judge, and the prosecutor next to me and me as the defense attorney, we do have to work with those laws, but we also have to work together to see the injustice or the inhumanity within those laws, if it exists as that, and work to change those laws. And together they affect all of us, the three of us, not just the person who is being accused. In the same conversation, I was able to say that when the question came up, well, you know, but who made the laws in the first place? I was able to say white Anglo-Saxon Protestant males, which in another conversation might be very difficult, but in using the strategy of inclusion, that I am just as oppressed, I am just as colonized as a Black woman. I can be sexist. I need to learn. It also allows for others to see where they have made a mistake. And it is not just a brush that is painted them, it is an evidence of their colonization, and they, together with me, see the mistake, and we can work to change it. So that strategy of inclusion, we really are all in this together. We are. If racism exists, then you miss the benefit of having a Mahalia Jackson's serenade. If sexism exists, you miss the opportunity to have brilliant Black minds send us to the moon. And it affects the person who would receive that gift as much as the person who was prevented from doing it. So inclusion, we are all in this together.
Yes, Tanzania.
Oh my gosh, Ms. Teri, you really just said something there with the inclusion piece as a strategy. I have never thought about that before. So thank you. So that was like definitely a gift for me that really just resonated. To strategize, which again, like within the context of the question, talking about mobilizing, like instead of, this is something that we're all going to practice, and this is something that's, going to bring everyone closer together, and it's going to make things more equitable, like you taking inclusion for the soft and fuzzy that it's supposed to be, and really like using it as a strategy to like, I love that. So I just need to harp on that for a second. That was amazing. From the public health, like on the ground point of view, so being a member on the Board of Health in Thurston County, a lot of the strategies that we are realizing as we collect data and do these community assessments is realizing, and I think both Mark and Teri spoke about it as well, this aspect of trust. especially within our community, that we just have such a massive, rightfully so, distrust against a lot of systems because they are, you know, have been weaponized and put us in a place where we have had to be marginalized historically, right? So trying to really come out and have these, and it might sound like silly to some people, but really, like, you know, giving people a meal, like having events where you have food and, you know, that disarms people, that makes full bellies, and people are a little bit more willing to utilize the resources. And also we have this class, and also we have these, you know, harm reduction materials that we want to give out to you, or would you be interested in doing X, Y, and Z? So really just sort of stepping in, and I guess, you know, shaking hands, rubbing elbows, and kissing babies kind of thing to disarm people in terms of distrust. And then when people have a comfortability, when they have a full belly, when they've had a conversation with you more down to earth, they're more willing to receive those more complex things, or those more complicated questions that, you know, they might actually need answer, but would have never felt comfortable asking you. You know what I mean? So that's one strategy that we've been trying to mobilize, not only with, you know, public health within the Thurston County area, but the work that I do in public health equity department with Metropolitan Urban League Seattle. That is huge, 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 huge. We actually have numbers on that. You know, they talk about it, the medical officers talk about, oh, you know, what's the intake and uptake of people, for example, just getting the COVID vaccine, staying at, up to date with the boosters and things of that. It is very low. Very, very low. People do not trust, people do not believe. And it's so concerning because it's not only the COVID vaccine now, it's all vaccinations. So children are not, all children across the board, but specifically within our community, are not being vaccinated in a way that they actually need to, right? To be going to public school and be exposed to these different things. They're not being vaccinated anymore at the rate that they once were, because the distrust, especially after and during COVID, has just exploded, and people have pulled back and people are uncomfortable. And so really trying to find a way to, and again, much of this is understandable and much of this is valid, right? Like people's feelings of distrust, I want to validate that. But there's also a lot of myths that people still believe, a lot of misconceptions. Young people are not seemingly, you know, on a large scale, as interested in gaining that information. To be honest, I believe there was something that came out the other day that said that, you know, young people are getting most of their health information from TikTok, you know, how to eat, how to protect themselves, etc. And we all know that that's great if the information is accurate, if the information is actually, you know, real, it's true, it's accurate information, and we don't know that. So just being able to utilize social media in a way to make information that might seem really boring or might seem really difficult to consume easy. So there's a huge health literacy piece that, you know, public health practitioners on the ground, we really have to, how can I make this where a 5-year-old is going to be able to understand it and consume it? And how can I really address this in a way that our elderly population, that's another population that is not getting the amount of attention that they need in terms of support, health navigation, really understanding things. They go to these doctor's appointments and they have no idea what the doctor's talking about. And Mark, you said something earlier too that is just so true. The amount of time that a person gets to spend with a provider is less than 10 minutes. I think it's like 6 or 7 minutes tops that you're actually in the room with your provider. So that's tough on people when they don't have a strong sense of health literacy. So really trying to break things down and make it easy for people to understand, make it consumable for anybody at any age and stage, and really getting out there and trying to let people know that we are not big and scary. We are not trying to tell you what to do. We are not in any way, shape, or form. We are here to offer you resources and provide different levels of access. And so, yeah, that's some of the strategies that we use in those areas.
Mark?
I'd vote for the two of you if you run for office. If you ever decide to run for office and, you know, start changing the power structure, I'm definitely voting for you guys. Yeah, you know, I think I think we all have the ability in life and in our workplace to do deep assessments of the culture in regards to what are those bias, where have we we all have blind spots, and that's fine. We all have blind spots, but I think a lot of those bias and that are based on issues of racism and classism go undetected, and which just causes this, repetition of oppression. I think another question that's been helpful for me is always asking who has not been invited to the table. And there's plenty, trust me, in case you were wondering, wherever you're at, who has not been invited to the table and why? And really think about, once again, going back to that, it's not gonna be comfortable, but why is that? And then figuring out strategies to, whether it's through food or play or joy and abundance. Folks have been absorbing toxic stress for over 400 years, and then you just expect them to trust, especially if they don't. The folks that are saying, "Oh, yeah, oh, trust me," like, why would I trust you? Right? You have to earn that. We were doing a kind of a co-design for the new clinic, and this one woman who had second generation using services and had her kids using services, she said something that I'll never forget, and that is, a lot of folks, they have to sell their story over and over and over again just to get services. So all these intimate details of stuff she's been through that was not pleasant at times. She has to tell her story over and over. And it's the only way she could, get services for her kids and for herself. And so I think there's something to be said about, her statement. There's hierarchy and silos don't provide are not good ingredients providing wellness care. They just aren't. And we have so much hierarchy, and we have so many silos, and we do things to the community, not with the community, which I've heard other two speakers talk about. So how do you figure out ways, strategies that is a constant communication loop? Because if you're going to ask for folks to give input, they need to know what you're doing with that. It's your responsibility to, get back with them and say, this is what we heard. Is this correct? These are some things that we heard say, and this is what we're going to implement, and keep doing it. It's not a one-time check the box, kind of thing. It has to be built into the culture. I think at a government level, policies need to change. I mean, we need to, and we have folks, but we need folks really, really, pushing for policy change, because right now a lot of the policies really just support the status quo, and that status quo is hurting a lot of people. There's a lot to be said. I think we have to get away from pathologizing. Not to say that diagnosing isn't helpful at times, but that's no way to treat folks who've been mistreated by, you're already stressed, and then you get slapped a label on you. It's like, well, that's great. That's not right. So yeah, let's do better, and let's do better forming, really assessing, really spending the time to assess where we're at as teams and organizations, and then from there asking who has not been invited. And
Yeah.
listen, sorry.
I was going to piggyback off of you, Mark. I didn't mean to interrupt you. Is it okay, Danie? If
Yes. Oh, I'm sorry. I'm enthralled. Yes.
Just listening to both Mark and Tanzania, in the sense of who we have at the table, making those policies. I also, I think that it is important that we ask ourselves the question, who are we inviting, and why are we inviting them? The same way that we are afraid to have those conversations about white Anglo-Saxon male policies that were made in the late 1800s for the purposes that they were and the effects of them. I have found both experientially as a professional and in community advocacy that marginalized folks will be brought to the table to make it appear as though there is an address or a redress to the fact that they have not been invited to the table before. I see my daughter on here, Keisha Bigby, and it's what a blessing that is to be able to speak to one of my children. In fact, we so oftentimes will bring folks to sit them down to make it appear as though we are addressing a need in the community. We who are colonized as Black folk need to strategize to not be used as a token of appearance that an issue is being addressed, recognizing that that takes up space where someone else could be there to truly address that. And then when we are bringing people to the table, do it with an authentic intent. We need to strategize to make sure the folks we're bringing to the table, we truly have the courage to give them the space to exercise that voice. We cannot be afraid to correct and improve ourselves. And it is remarkable in listening to my fellow panelists in that theme that I see running in there. Thank you for the space to be able to speak to that point, Dr. Danie.
Absolutely. I have to say, every time y'all say something, then I'm like, oh yeah. And then somebody else says something like, oh yeah. I feel like I just really need to say this, is that when I think about strategies, particularly around this work, and when I think about my career has been about creating space, creating tables, and creating containers so that we could have these authentic conversations. To be able to move the work where the work is maybe not being moved in different places, is not maybe informing system in the way that system needs to be informed, but that there's a space to be able to do that. And I'm just so grateful to have all of you here so we can have these conversations. I think the strategies that I think about are also the idea of leveraging what exists to create what doesn't exist.
There it is.
Right?
There it is.
Right? All right. We're gonna have just maybe a few more questions just quickly. What are, actually, I'm gonna skip this question. Looking ahead, what are some key priorities or areas of focus for advancing behavioral health initiatives within our community? That's a good one, right?
Mm.
You know, Mark, I'd really like you to. I know he's gonna say. Oh, okay, okay. Tanzania, what you got?
All right.
I know, right? It's good.
Oh, it's so hard looking ahead. Okay. Key priorities or areas of focus. I like to think of those things as like my pillars, you know? So like just, yeah, specific things that we're really going to work on. We're really going to spend a lot of like time, money, and resources to like stand these particular things up. And so in regards to our community and behavioral health around this, I do think, I mean, Teri and the practice and work that she does every single day, as well as Mark making a comment about this, I do think that there's a real disconnect. And I don't understand this sometimes, you know, and it just could be because my you know, inexperience or youth, or I'm not sure, but I don't understand why there isn't more organizations, BIPOC organizations or just nonprofits or what have you, that are fully and solely dedicated to lobbying or advocacy specifically related to like legalities and like policy. And I know there are many out there. And I know that, a law firm can only do so much, or like one lawyer or something can only do so much. But I would love to see some more community-based coalition-like partnerships between my nonprofit, we have Urban League is very, very old within the country. The one has been here for over 100 years, and there are 92 affiliates. So there are 92 urban leagues in the United States. It's like if every single one of us was partnered somehow in a coalition type of partnership with a law firm or with like a lawyer, or we actually somehow we're able to, because I know there's like certain rules, right? Like you can't lobby sometimes, or like you can advocate, but you can't lobby, which is like crossing a line. So I know there's some things there, but I would love to see more work around like trying to specifically change policies. And that might look like more on the local level. That's why I'm on the Board of Health now, because it's like, hey, that's at my level, that's civic engagement that me as a regular person in my community can do to affect change and to inform people and try to make a difference. And so I would love to see that on a larger scale in a coalition style, just directly and solely focused on policy and changing things that are based in law.
Mark?
I couldn't skirt it again, could I?
Yeah.
Once again, I think, and Teri, you mentioned this a while ago. Having historical context helps us in regards to how to move forward. I think that somebody wrote in the chat about wellness not being an 8 to 5 job or what have you, and that's so powerful and correct. At least in the years working in community mental health, federally funded community mental health, I think that it's not a coincidence once again that the culture is based on deprivation. It's based on always trying to figure out where funding is going to come from. Oftentimes overworking staff because reimbursement. All these things go back to what you're saying, Tanzania, in regards to policy change and going from a culture of deprivation, which doesn't allow for coalitions because everyone's fighting for themselves for the crumbs that fall on the floor. And so therefore there has to be major policy change. I think that, you look at the what's going on with public schools for the most, but it's a generalization. We're losing a lot of our kids of color, especially young men of color, at 3rd grade. Now, why is that? Once again, that tough conversation. And consequently, we have to look at going upstream, like why are we not putting more, even though it's starting to change, I think we're putting more value and money into prenatal support. I think that infant mental health, affordable childcare, once again, going back to social determinants of health. I mean, this is where it gets really broad, but the thing is we're so disconnected and fragmented that the safety net that was never really great for marginalized communities is even more frayed. So how do we start connecting that not only safety net, but like net of strength? And that's a tough job. I've said, and I'm not going to, this won't be my last statement about it, but I don't want it to be the statement, is that I think that the mental health system is doing exactly what it's designed to do. And so therefore we have to break it down and redesign it because it's working fine. Like when I say it's not broken and people are like, are you crazy? I'm like, yeah, maybe a little bit, but no, it's doing exactly what it's designed to do. And so therefore this whole conversation that hopefully is going to spread out. Like I think there's love contagion. I think there's knowledge contagion. Like contagion doesn't have to be a terrible thing. And this is proof of it. Like take these conversations or whatever you took from this conversation and start, saying we're not to say you're not doing it prior to this panel. I would not be that bold or egotistical. But we have to lower hierarchy. We have to get more diverse folks working in the community. And a lot of people will say, well, we have to build that pathway. That's such a, oh, I almost cussed. That's not an intelligent statement because it makes it sound like, oh, we have this pathway that we can pull up these poor folks of color to work in the community. No, maybe the pathway has to go the other direction also. Matter of fact, it does. Not maybe. So there's lots that we can do, but we need to go upstream, and we need to change policy, and we need to get more diverse staff, among 1,000 other things. But I want to hear what Ms. Teri has to say.
Me too.
The validation that y'all give me, that affirmation, that is the priority to the families. We need to just go right on down to the local grocery store level and focus and prioritize the family. And I'm not talking about a traditional type of a family. I'm talking about family. When you think of family, it is a place of home and love. I don't care if mom is alcoholic and dad is shooting up. If they live in the same household and they got babies underneath them, family, affirming and validating that family, accepting them where they are. That is the new policy. And supporting that family from the single mother, that Thelma Mae Williamson Rogers and William Earl Rogers, who supported this 19-year-old little girl who had not yet graduated from high school, mad as all hell and get out, coming home pregnant, and taking and supporting that family, that mama and that little boy where they were at through high school, through college, through law school to become the boss ass attorney that she is today, supporting community. I am a living testimony and example of direct support of family, not defining family for family, but letting family define itself and supporting them where they are at, including by direct giving. There was a story about a mama who got $9,000 in Washington, D.C. during the pandemic, and folks were hella mad because she took that $9,000 and took her babies on a real trip. They went to like Miami or something and got brand new bathing suits and suitcases and iPods and all the other stuff and got on the airplane. These babies had never been on an airplane before. When my father did that for me at 10 years old, took me with him on one of his business trips, it changed my life. All that $9,000, $12,000 that that young lady spent up on that family is all gone. They're mad because do not judge. Support that with direct giving and allow them to take a breath and exhale. That should be our priority. Our babies are dying. They are killing one another because at 15 years old, they are so stressed because their parents, whatever that looks like, are not able to support them. A 10-year-old child committed suicide. I read the story yesterday from being bullied every day in school with other babies who are having that same stress, experiencing it, manifesting it, because they do not have that support. Our priority and our focus should be on family, and that includes direct give with no strings, no questions asked. I thank God for my parents who were unconventional, unquestioned, irritated, but loving and supportive. And I would not be here had it not been for them. And I am here because of that focus, that priority to bring me up. That is my idea.
Oh, you better say that, Miss Teri. You better say that for sure. You know, it's interesting in listening to all of you. Again, when I think about key strategies, I think about like, what's the way out? What is it that we need to build up? And for me, it is always about literacy in terms of like mental health or health literacy. And literacy is also about access. You don't have enough access. You can't get to the access. You don't know what's available. And it also is about services. It's fine to be addressing an overall issue, but if there is no way to get help and you haven't shared how to get help, it makes no sense to me. I think that our money, as it relates to funding, it's not infinite, right? It's not something that's going to be, we don't have tons of it. So we have to be smart about how we fund and what we fund and who we fund. Are they going to be able to create what it is that we need created? And there are a variety of different things. I just think that that needs to be our movement forward. We need to be thinking about, what do we need? How are we going to build it? Who needs to be at that table? How do we share that information? And how do we provide access to the most people that we can?
You know, Danie, along those lines, quick example, 15 years ago or so, maybe a little more than that, the director of the Boys and Girls Club, Rainier Vista, in Rainier Valley, called saying, we have so many kids that are dealing with so much trauma, and our staff also are dealing with a lot of adversity and challenges. Could you please, please, please get a therapist from the clinic and have them, come down, et cetera, which, at the time we were doing a lot of work in regards to integrated care within our primary care and dental clinic at Odessa Brown. And so we knew the value of integration, but it gets really interesting because, you stick any one therapist or so in a big organization, and within two weeks or so they're going to be overloaded. The need is just so great. So integration really is about a philosophical, conceptual paradigm shift for all staff to be, given skills to be able to connect and do their jobs better. And that's more so true now than ever in regards. So we don't have enough mental health clinicians, like you were saying, Danie, in regards to access. And so I think the onus is on us to figure out, how do we get those skills to the people that are already working with children. And not to say they don't have the skills, but in regards to bus drivers, kitchen staff, when we did this at Odessa Brown in regards to our facilities folks, our security, everybody. Why are we just holding this information about childhood development and trauma and what have you to just like people that have letters behind their names? That makes no sense whatsoever. And so let's get more of that, disseminate that information across the board. To wrap up this story, I'll try to do it fast, is that, they didn't have money for us to embed a clinician, and that model wasn't going to work very well, even though it's a step in the right direction. But they had a beautiful soccer field, and they had all kind of kids in the housing community, and a lot of them weren't reaching out due to cultural issues and accessing services. So I decided to do a soccer clinic over the weekend. And this is, like I said, 15 years ago or so. And we had like 60 kids, 60, 70 kids. We had I was like, this was more successful than I thought. And this is just an unfoldment of having relationships, kind of like you're saying, Ms. Teri, in regards to go down to the grocery store and, talking to families and talking to staff. And what ended up happening was started a soccer wellness program where we embed social emotional skills through play. This can be done in any activity. It doesn't have to be soccer. It doesn't have to be just sports. And the kids are having a ball. They're running, they're laughing, they're sweating, they're making new friends, they're figuring out how to deal with big emotions. And our kiddos that have big emotions that don't deal with it well, look what happens to them. You're talking about killing, you're talking about incarceration, all the things that we know, right? And they're doing it, but it's not in a clinic. It's where they live, learn, play. They're having a blast. It's these kind of programs that all of us can be, replicating and creating with community that, you don't, and they don't have a diagnosis. Isn't that beautiful? That's great. And guess what? Can we do it tomorrow? Can we do it tomorrow? Like, rarely did I have a kid come into the clinic and say, oh, can we meet every day? Like every once in a while, there's a kid that might do it. But for the most part, make it fun, make it joyful. And guess what? They have a ball and they don't even know they're getting social emotional support. And the parents love it.
That's right.
All right, I've got just a really quick question before we go to questions. And it really is for each of you, can you just tell me one or two things quickly about what inspires you about this work and what your hope is related to this work? Ms. Tanzania.
I was ready to go first, so thank you so much for calling my name. Honestly, because just sitting in this space with everyone right now and just seeing how many people are participating in this, seeing how many different people from different professional backgrounds and different, cultural backgrounds are here today to listen. They are responding to this call to action, and to be a part of this panel, that is what inspires me. Because when I have my head down, or when I, have had a difficult encounter with, somebody on the street I was just trying to help, and they're having a bad day and they don't know me, so they're having a bad reaction. When, my 5-person team is being given event after event after event in these different cities, and we're trying to make it work and we're trying to make it happen because we know how important it is to deliver those direct services like vaccine clinics and things like that to people. When it's a struggle, when I'm frustrated with my community, it's literally like that, where it's like, I'm shown right here, this right now. These conversations, other people who care just as much, their brains and their hearts are just booming for this work and to do it together. So I am inspired by you all. I'm inspired by the people that I am graced to be able to help every day, because they're really helping me as well. And I'm inspired by, people like yourselves, you, Mark, you, Teri, and of course, Miss Danie Eagleton. You are one of my mentors, truly. You guys inspire me to continue to drive forward and try to do any and everything I can around this type of work. So thank you.
Ms. Teri.
I just want to say thank you again for this space. And I too am really inspired by Tanzania and Mark, and you, Dr. Danie, like literally inspired. This is hard work, and it often leaves me with a feeling of helplessness. Like, it's like, yeah. But I am also inspired by not just the folks like you all that literally build me and sustain me to keep going and doing it, but by the people who are living it, by parents who they somehow keep going after losing their 10-year-old to a tragic situation, by single moms. I know how hard it is, and managing, and by people who, through, maybe their actions, but also through circumstances that brought them to their actions, who are going away courageously to do 2 or 3 or 10 years in a prison situation. I'm inspired by that. And my hope is that I get to continue to do this work, and that in just one person, I can make a difference, like the 5 or 6 one persons over the course of my lifetime who have made such a difference in my situation, that I'm able to really look at where I get to sit today. That is so, like, one person, if I could do the same thing for, that's what I would say.
Mark.
I'm inspired that we're here together. That makes, and I've heard everyone else say, but it is And we need this. We need to be able to, you know, fill our tanks back up because it is hard work. I'm inspired when we do reflections in the soccer wellness program, and this is about talking about feelings. And they're like, well, how did you deal with frustration during the session? These kids, their arms are flying up in the air, like they want to talk about this stuff. They want to learn this, right? It's our responsibility to, you know, package it in a way that's fun for them, right? But they want to learn, they want to grow, and the stuff they say, absolutely brilliant, just brilliant. Not brilliant for a 6-year-old, but just brilliant life-wise. I'm inspired, you know, doing promoting first relationships, which is the infant mental health program, and going into, you know, homes, asking to go in. Um, and a lot of these, oftentimes moms are just, they feel terrible about themselves. They're not good at anything, right? And they're especially feeling they're not good as a mother. And with this program, we asked if we could film them playing with their kids. And the first couple times, there's reluctance and like, well, just give it a try. If you don't like it, then we won't do it. To do it a few times, and you're pointing out the positives that are there. You're not making up stuff. You know, a lot of times people say, well, you know, you're a therapist, you're paid to say nice things. Okay, but we have video, we have proof. So let's look at it together. And you point out, like when you looked at your daughter's eyes and did you see her sparkle? Well, you know what that's doing with her brain and her development, and that, like, that's not a lie. They're looking at it, and sure enough, you know, injecting love is reflected in love. They start to feel better. They're like, wait a second, I'm not a terrible mother, right? Whatsoever. So, I mean, it's that kind of concept and philosophy that, you know, and that's why we're all here. So it is about us. I totally agree. And love is reflected in love.
Whew. Yeah, I will tell you all. I mean, the idea, what helps me to kind of continue to move on and to do the work, the idea of hope and the idea of when I work with students, when I work with clients, and me and the client or student, and they are engaged, and we get to transformation, there's nothing like it. Working with people and having seen people who have come into community behavioral health and having created a system that they could graduate from, unheard of. I'm hooked. The idea of being able to work with my students and to have one of my students come in and say, I'm only going to go into private practice. That's all I'm going to do. I'm only going to do that. And by the end of the master's program, I'm hooked on community behavioral health. That's the work I want to do. That gives me amazing hope. And I am absolutely excited about those things. And it helps me to have hope for the work that we do in our system. All right, now we have some time for questions. And I've got a couple. And if anybody else wants to put more questions into the chat or into actually the question and answer function would be helpful. My first question that I have is actually from Greg Banks. And Greg says, good morning and thank you for the forum. What would it look like for the African diaspora to use more culturally based healing for our mental health? And that's a great question. That's a really great question to think. Do any of the panelists want to take a stab at that first? Tanzania, I see you shaking your head.
Definitely. Mark talked about this really early on about community healers, and in every aspect of, you know, our culture specifically, but cultures around the world, they've always had that medicine woman, that, you know, that doula, if you will, that healer that lays hands over you, or, you know, she's got the herb to heal the wound type of thing. So I do think there's one, I think it could be very cost effective to create these spaces and these sort of like seminars or these classes or these series that are in person, where we're really just focused on wellness. We're outside breathing fresh air and we're looking at colors. Something I like to tell my kids, and I kind of had to create this for myself as well, eating colorfully. Like when I look down at my plate, it's not necessarily about having everything measured or anything like that, but do I see a plethora of colors on my plate? I'm probably doing okay. I'm probably got those phytonutrients that I need to keep me balanced and feeling normal, which also affects other, chemistry in the body. So I don't want to go too far into that, just because I know from, again, a mental health perspective, there are people whose chemical imbalances actually need medication and need other more complex interventions. But I do think that there is, thank you for that question, because there is a little bit of like a gap of just creating wellness spaces and creating like walking, like simple things, again, at every level. Can the 5-year-old do it? Can the 75-year-old do it? We're just walking. We're going to transport everybody if we can. We're going to go to this space and we're just going to be in an open green space and we're going to have a colorful lunch together. And we're going to do this, 5 times. And that's one series. I do think that us on the ground, in terms of it's might be a little bit of a push, depending on what your, upper leadership looks like and what KPIs are looking like for everybody. But I do think that that's something that us at our nonprofits and things of that nature are more capable of doing. And I think that's something that we could do. But what it would look like, I think it would look like eating colorfully. I think it would look like spending time outside. I think it would look like coming together with other people, no pressure, just being in community and creating rapport in that way.
Just jump in. Miss Teri, Mark.
I would just say that I think it also would look like validation and affirmation, especially for Black folks who have had stolen and withheld from them their cultural identity in so many ways. I think that it would aid in our healing by having that validation and that affirmation of our, and in some ways, education of our cultural methods of loving on ourselves. So I would definitely say that it's a lovely thought.
Yeah, I like the question. As we know, not all Black folks are the same. I know we talked about this earlier, so you might want to ask, like, what would that look like for you, and how would you want it to look like? I think from and I, for years, just like anything else, there's fads, and I think with mental health, Seattle was kind of known as, it was a CBT, cognitive behavioral therapy kind of hub, and with that, and I'm not saying that's bad, but we miss out, especially in regards to cultural sensitivity stuff. Like, there's all kind of dance, singing, art, that are powerful, that we should have a repertoire of different, more creative and joyous activities that help with collaborative healing.
Yeah, I would agree. I would say, just quickly, I started my career at Therapeutic Health Services on Rainier Avenue, and some of the things that we would do, because at that point it was a predominantly African-American population that we were serving, we would have Harvest Feast, for Thanksgiving.
Yeah.
Right? We would come together. We did, before Juneteenth was a thing, we were doing Juneteenth in Seward Park, where clients and staff were getting together. This idea of creating healing spaces just so people can be present for each other, I think that's what I think is important. The idea of a healing space in that respect, having a healing space for the people who provide care. I think all of those things are extremely important. All right, I have one. Well, oh, here we go. This is a great way for us to end. This is a question. I think it's Bakima. I hope I'm saying your name right. says, thank you so much for your time, efforts, and healing offered from your exploration here today. I'm feeling extra filled and walking away with hope and rejuvenation amidst some loudly heavy current events. Here's the question. Do you have any advice on sustainable mental health and SJ social justice advocacy involvement for an upcoming counselor? Yes, indeed. Current intern in Spokane area, financial capacity, skill-wise. Well, you know, I love that. I love that question, right? Please get a mentor, keep going, reach out, read what you can read. Just keep reading, keep connecting. That's what I got to say. What do you guys got to say?
Especially that mentor. Keep a mentor. I still have mentors. It's 20 years. And it is so important to remember the concept practice. Every day is a new day. And be humble and be kind to yourself. You can always learn more, but you are doing the very best that you can. And how remarkable that you are here with this education in this space. Thank you for your service in advance.
Don't lose yourself. Don't lose your beautiful self. Don't
Don't
let anyone take that away from you.
That is a whole word.
I feel like you guys said it all, but I would say to Mark's point, the don't lose yourself. Self-care is really important. When you're taking a lot of time and you're using your heart space and you're using a lot of your brain power to care for other people, you cannot forget to take care of yourself. That's going to be really important. And I cannot stress enough the aspect of a mentor, of connecting, and that might take you longer than other people, that, you know, every person that you align with that you're hoping is a mentor, sometimes they end up not being so knowing that you're going to kind of ebb and flow in and out of that sometimes throughout your career, I think it's really, really, really important to always continue and search out and seek out people that you can learn from and people that can continue to help you learn when you're in the midst of your career.
You're muted, Miss Danie.
That's good. I can't believe that we are at the end of our time. I want to thank the panel. It's amazing, amazing panel in terms of what they've given to us today. This has just been an amazing conversation, and I thank you. After the webinar, please take a moment to fill out the evaluation form to ensure you receive your CE certificate. We'll share a link in the chat and send a follow-up email with the same link to today's attendees. Also, please save the date for our 5th annual Reimagining Behavioral Health, Race, Equity, and Social Justice Conference on September 26th and 27th. Registration will open in early June, so stay tuned for further details. Thanks again to the BHI and the Washington State Healthcare Authority for their support in making today's presentation possible. And thank you for joining us today.
Thank you, everybody.
Thank you.
I appreciate the time and space. Bye, everyone.
Bye-bye. It was wonderful.
Truly.